All right, we are recording, so we'll go ahead and get started. Thank you all for being here for our COVID-19 media briefing. Um, we have a jam-packed call today. We'll have District Health Officer Kevin Dick with a summary of kind of COVID-19 in Washoe County. We also have a special guest, Ann Silver from the Reno Sparks Chamber of Commerce, who will provide just a kind of some summary of updates and also address any questions you guys might have. Just want to let you guys know of a couple things we got going on. We're doing a press briefing today. We're also planning on doing some for the next few Wednesdays, starting not tomorrow, but the following. What I'll do is I'll send out another calendar invite with the meeting information on that, just so it's on your guys' calendars. It's one of those things where it's hard to forecast how long we're going to be doing them, but we're getting a lot of media requests, so we want to make sure that we give you guys access. So expect a calendar invite to everyone that was on this chain for this press briefing. If there are others in your organization that want to be added to that, feel free to either forward the invitation or send me an email with that person's email address and we'll get them taken care of. The health district is working to hire some more personnel to help with the COVID-19 response. We are looking for EMTs, registered nurses, people who can help with our traffic flow, disease investigators, and call center staff. Here in a minute, I'll post a link to the company that we're working with to hire those temporary workers. We'll also send out some information on social media about that if you want to send that out in any of your reports. And then we have some community vaccine sites going up this week. One-time deal. We're actually at the DMV right now until 4 o'clock doing COVID-19 vaccines. We have pods at the Boys and Girls Club on Bresson Way tomorrow, and also at the Boys and Girls Club on Foster Drive on Thursday. We'll be at Lazy 5 Regional Park tomorrow. And then on Friday, we will be doing our Food Truck Friday event, as well as a community pod at UNR. Given the air quality conditions, we may determine that it is unsafe to have our staff out there giving vaccines, or the event might shut down just because of the air quality. If there will be updates on the COVID-19 Washoe Twitter account, as well as the Washoe County Health District Twitter account, if any of those things do occur. And lastly, we're doing the second of 3 back to school vaccine events. The next one is this Saturday at the Health District from 9 to 1. So any of those vaccinations, like MMR for measles, basically the vaccines that are required to enter the school district, we'll have them all there in one place. We had a great showing last weekend, so we're hopeful people will show up. It's this Saturday from 9 to 1. All right, I'll stop talking. With that, I'll pass it off to our District Health Officer, Kevin Dick.
Thank you, Scott, and thanks everybody for joining us today. Unfortunately, today I'm going to start my briefing with some unfortunate news, and that's that we're reporting our 697th death today. This person was a male in his 80s with several underlying health conditions, and this individual was fully vaccinated. We're still investigating this breakthrough case and working with the state lab. We don't have the genomic sequencing yet to determine whether this was the Delta variant or not, but we will provide that information when it's available. This is tragic for our community, and we know nationally that the vaccine is very effective in helping to avoid hospitalizations and deaths. However, we also know that it's not 100% effective, and there are going to be these cases that occur. And I think it's important for our community to understand that we need to look at the number of vaccinations that have been provided nationally, the number of people that are hospitalized nationally, the number of deaths that occur nationally, rather than looking at just our limited numbers from our community. And unfortunately, we're a community that has had a death. There will be others that have not had a death in their community. That doesn't mean that the vaccine is more or less effective in those two different communities. And so we do need to be looking at those larger numbers that we're getting from our national statistics that do show the great benefit of the vaccine, to prevent hospitalization and death. But as we have high numbers of cases that are occurring in the community, that does provide more opportunities for breakthrough with the vaccine. And we also know that the Delta variant is more transmissible, and we would also expect that to have some impact on the breakthrough cases that are occurring with Delta in the community. The latest state numbers show that we have over 237,000 people in Washoe County that are fully vaccinated over the last 8 months, and we've administered more than 484,000 doses to residents in our community. We know that these people have benefited from receiving the vaccine, have reduced the number of cases and deaths that are occurring, and now we do have our first death that has occurred amongst a vaccinated individual. So I think it's important that we provide this information to the community. We report information that we have, that we can under the HIPAA privacy protections. And this is important for us maintaining trust in public health for our community. We also have seen an increase in hospitalizations in Washoe County. As of today, the Nevada Hospital Association is reporting 102 current COVID hospitalizations, people confirmed or suspected in Washoe County. And that has quadrupled since July 9th. 20 of those cases have been admitted in the last 24 hours. We're also seeing an increase in the number of cases that are in the intensive care units. I believe it's 25 cases, so almost a quarter of those hospitalized in intensive care, 8 individuals on ventilators, so almost 8% of the hospitalized cases for COVID-19 that are on ventilators. We've also seen the Truckee Meadows COVID risk meter has gone from high to very high last night based on our local conditions. So we are at very high risk of COVID-19 transmission in Washoe County. That meter has been moving up, and it's approaching the critical levels. Under the CDC criteria, we continue to be rated at their highest level, a high risk for transmission in Washoe County. We've also seen a sharp uptick in our COVID-19 testing at the Reno Sparks Livestock Event Center. So we had nearly 500 people show up for testing last Friday, and we had over 350 people yesterday that showed up for testing. The levels that we're seeing are a 16-fold increase from what we had for people coming through for testing just a few weeks ago. And it's, I think it's alarming to see that yesterday, as we were providing vaccinations also, we had 5 times as many people showing up to be tested because they were concerned about whether they had COVID-19 versus the people that were showing up to get vaccinated so that they could avoid getting COVID-19. And what we're seeing is a test positivity rate that's climbed to 16% in Washoe County, and our 7-day moving average is over 150 new cases per day. So we are climbing quite rapidly and alarmingly with the number of cases that we have, and the vast majority of those cases are unvaccinated individuals. So I don't know how to put this any more simply, but the COVID-19 vaccine offers protection against COVID-19. And you're better off getting it if you can. And it's never been easier and more available for people to get. So I strongly urge you to get in the line to get vaccinated so you don't end up in the line getting tested and finding out that you're positive for COVID-19. And I encourage people to do your own research from reputable sources, to look for information that helps you make your decision. And I think if you really look at the reputable information and you look at the situation that we have here in Washoe County, you'll be able to determine that if you can get vaccinated, it is time for you to get vaccinated in Washoe County. We're getting a lot of calls at the health district complaining about businesses that are not requiring masks. So I'd like to remind everybody that the governor's mandate requires masks in indoor settings, and outside of your household, and in crowded outdoor public settings. So I would encourage everybody to comply with that mandate in order to minimize transmission of COVID-19 in our community. And with schools reopening yesterday, I want to remind everybody of the importance of their role in keeping our schools open. I think the school district has done a good job of putting plans together to minimize the potential for transmission within the schools. But we know from past history that we have a lot of transmission that ends up occurring with after-school activities and with the behaviors of households outside of school that leads to people getting infected and then attending school. And that can be quite disruptive for staffing, can be disruptive for families if they have classrooms that are closed down and children excluded. I think we all need to do our part to make sure our children can continue to go to school and get that education and that socialization that's so important for them. So that concludes my remarks, and I'm delighted that we have Ann Silver with the Reno Sparks Chamber of Commerce with us today. And so I will turn it over to Ann.
Kevin, thank you very much for including me. Just a few comments. You know, from a business perspective in Washoe County, we're all watching the COVID-19 rates that you just discussed here in Washoe County with definite concern. None of us want another shutdown, nor do we want restrictions on capacity, but we also want to make sure employees and customers are safe and that commerce can continue. The Chamber continues to encourage our members to comply with the governor's mask mandate and to make sure customers are doing so. This also means that we all need to support the service workers who are dealing directly with the general public and are being put at risk on a daily basis if customers aren't wearing masks or they're being harassed about the mask mandate, and that just doesn't seem fair. As many of you know, our food and retail service workforce in Washoe County is stretched pretty thin already. So if cases keep rising and workers have to take time off to recover, this is certainly going to impact our businesses as well as all of the local customers, tourists, and other visitors. Let me just say that we're encouraging our members to choose to get the vaccines and to encourage their employees to go to the places that have been mentioned today and to get cases starting to go back down so that business can fully resume and we can build back our economy. Thank you, Kevin, for allowing me to make these remarks.
All right, thank you very much, Ann, for that, and thank you to Kevin as well. We'll now open it up for Q&A for media to ask any questions. Can you please specify which person you want to answer that question? That would be very helpful. So please go ahead when you're ready.
Kevin, Dick, this is Jerry with This Is Reno. What is being done to monitor compliance in businesses with the mask mandate?
Well, the health district's role is to continue to work with the resort properties that are regulated under the SB4 regulations for the larger hotels and casino operations. And so we're continuing to do that. As far as other businesses, we're receiving calls here of people that are complaining, and we are referring those to the state OSHA program. And state OSHA has indicated that they are responding to complaints that they're receiving.
Hi, Kevin. This is Siobhan from the Reno Gazette-Journal. With all the talk about higher education and that kind of moving forward of vaccinating of students, and the governor's now is going to have you either have to prove you have a vaccine or be tested weekly for employees at higher ed. Do you think the same thing should happen for K through 12 employees and teachers?
Well, that's a decision that would be up to the school district to make. Under the directives that the governor has put out, clearly they're being provided some autonomy for what they want to decide with the schools. So it's either the school district, or if the governor were to take a change of direction in the future, they could also make those types of requirements.
Do you think, with your expertise and your knowledge, that K through 12 educators should be vaccinated?
I would recommend that everybody that can be vaccinated be vaccinated.
Why do you think they're not having that discussion yet then?
I'm not aware of what discussions they're having and not, so I really can't comment on that.
Hey, Kevin, this is Michelle from 2 News. Thanks for holding this press conference. A lot of businesses have reached out to us concerned about the high case count, obviously, but some want to know if there is a shutdown predicted or what would prompt another shutdown, and if you guys have a threshold you're referring to.
Thanks, Michelle. As Ann Silver mentioned, nobody wants to be moving back to a shutdown. And so I think that's why it's so important that we deal with the minor inconvenience of wearing a mask so that we can help to prevent things from getting worse while we're continuing to have people get vaccinated to increase that vaccination rate for our community. So, I think that we're hopeful that our community can pull together and do what we need to do to move through COVID-19 and get to some other side of this. Right now, we seem to be kind of stuck in the mud a little bit, and so we just need to renew our efforts. Everybody do their part so that we don't get into that situation of needing to do further mitigation that could lead to reduced capacities, closures, those sorts of things. I don't think anybody wants to end up in that position.
Sorry, this is Michelle Lorenzo again, but considering that the case numbers are reaching a high point compared to January, would you, with your expertise, recommend that we go back to what we were doing back then in regards to social distancing and capacity?
We're not making that recommendation at this time.
Kevin, Dick, this is Drew Mayer from News 4. My question is, it's obviously concerning that an individual who is fully vaccinated has now died from the virus. I was wondering what you think likelihood of breakthrough cases are in Washoe County.
Well, we know we're having breakthrough cases, but we also know that most of our cases are occurring in unvaccinated individuals. And the COVID-19 vaccine is not different than other extremely effective vaccines like the measles vaccine. There are breakthrough cases that occur with the measles vaccine, but we see those very rarely because we very rarely see the measles. So, in our past history, it was big news when we had one case of measles in Washoe County, and we're doing everything we can to disease investigate and contact trace and try to keep it from spreading any further. We've got 150 new cases per day of COVID-19 that are happening in Washoe County, and it now is being described as being as transmissible as the chickenpox. And so with that level of disease in the community, that level of exposure that even the vaccinated people that have this highly effective vaccine on board are protected with, there's still going to be those cases occurring. And what we really need to do is to suppress that level of disease that we have in the community so our COVID-19 cases are rare and our vaccine can protect us from the few exposures that we may encounter.
Thank you.
This is for Ann Silver. This is Siobhan. Do you have any businesses under the chamber that are requiring that their employees get the vaccine? And if not, why do you think no one's requiring their employees to get the vaccine?
Siobhan, that's a good question. And from what we understand right now, about 30% of our 2,300 members are in fact requiring the vaccine as a condition of continued employment, or they are requiring it for new employees. We totally support that. For those who aren't, I think they are very concerned about the resistance they will get from specific employees, be it political, religious, moral, social, cultural. There's great sensitivity to people's feelings about the vaccine, but we are encouraging employers to exercise their right to require the vaccine. It's sad that it might get to that point, but we're encouraging people.
Any kind of trends in what businesses are requiring employees to get the vaccine?
Yeah, we're seeing trends in food service and retail, which really makes up the majority of our small business members here in the community. I can't speak for the larger businesses like Tesla and Panasonic that are our members, but we're getting more calls about may I require the vaccine of my employees, and we know that yes, they can, and we're
And what about, I
encouraging them
know
to do so.
healthcare is kind of included, join the chamber. Are any of those organizations pushing that way? We've seen it kind of happening in other parts of the country. Is that not happening?
Are you referring to healthcare organizations? I'm
Yeah,
sorry.
health, or like hospitals and, other
Sure.
stuff like that.
Well, certainly through our Chamber Association health plan, we're making our members aware if they're on it, if they're a business between 2 and 50 employees, that they have every right to go ahead and require the vaccine. I do know that the major hospitals here in the area, would like to see less people showing up for testing or needing hospitalization. And so I think if we were all sitting in a room together, everybody would say, let's push for everyone to get vaccinated. It's a slippery slope, though, as we know, because of the incredible resistance and the fierce fights that ensue. And from my standpoint, I'm very concerned about the frontline workers, and I'm not talking about nurses and doctors and EMTs now. I'm talking about retail and food service workers, people who keep commerce flowing, who are taking the brunt of the criticism about the mask mandate. And they have to wear masks 8 hours a day, and everyone wants to get their food or pick up their takeout or shop. And so I think this has to be a community effort and an understanding that unless this mask mandate is fully enforced, we're not going to get rid of this thing, whether it's COVID or it's one of the variants.
And were any businesses talking, or is the chamber in support of kind of like we see it in New York City, I think, a vaccine card where you're not going in to a business if you don't have a vaccine card?
Well, I can tell you at the chamber, we are enforcing it in our office. And for those events that people come to, you have to be vaccinated and you must wear a mask. We have not yet gotten to the point of where we're saying to our members, as a public policy, the chamber endorses a vaccine card. I think we're all treading water right now. Kevin's data is so significant, and undoubtedly many community leaders and influencers are going to have to get together and say, how do we do this collectively? We're back where we started from, and with the positivity rate, it's as if it's deja vu all over again. So I think we'll need the level of cooperation we needed months and months ago, where we're all on the same page. Otherwise, it's hit and miss kind of reaction to the increased numbers we're seeing.
This is Michelle from 2 News again. This question is for Kevin again. We're wondering what the hospital staffing levels are looking like right now from what you guys know, and are staffing levels adequate enough to handle a possible surge?
Michelle, I'm afraid I don't have details on the hospital staffing levels, so I guess I would refer you to the Nevada Hospital Association. But I would comment that while we are seeing an increase in the number of hospitalizations occurring for COVID-19, and we're concerned to see those numbers rising, I'm not concerned that we're approaching levels of reaching hospital capacity. I think we have plenty of healthcare capacity to deal with a number of cases that are occurring right now.
Thank you. And I have one more question, I promise. We're looking at the demand for COVID-19 tests, and in some pharmacies, it's been harder for some people to get a test in an adequate amount of time. We're wondering if you guys have an ample supply of testing, and nowadays, how fast are the results coming in for that?
So we do have an ample supply of test collection kits, and the state lab is able to provide us with 24-hour turnaround time. But I am concerned with the increase in demand that is coming to our post for the testing. As I mentioned, a 16-fold increase occurring is quite a lot to be able to try to ramp up and staff for. And as Scott mentioned, we're looking to bring people on board for staffing. At the health district, we're facing the same staffing problems and shortages of positions, people applying for positions as the rest of the community is. And so I'm hopeful that our healthcare system can help through our providers making testing readily available for individuals, and have reached out to the state and they to the federal government on the testing available through our pharmacies, and have discovered that there is a supply problem right now with some of the rapid test kits through Abbott Labs that they're working to resolve, and hope to have that addressed within the next couple of weeks.
This is Siobhan again. Based on your kind of experience and tracking numbers, is it only a matter of time till you have to shut down some schools or classrooms just based on the sheer volume of cases we're seeing? You know, when do we really see it hit the schools with school just going back?
Yeah, thanks, Siobhan. And you know, as hard as the school district is trying and will continue to try to mitigate the spread of the disease, these are challenging times to be able to go unscathed through school reopening and everybody returning to classrooms with the level of transmission that we have in the community. And the schools don't operate isolated in a bubble within our community. The children go home to their families interact with others, their parents are going to work. So those will lead to cases occurring, transmission occurring, and I anticipate that we will have classrooms that we need to close down if cases are occurring there. But we'll be working together with the school district, and that's why I'm appealing to everybody to do your part. If you want your children to be in school, you need to do what is responsible outside of those school hours with your families to be able to avoid getting COVID-19 and avoid having your child go to school with it and potentially infect others there.
Are you worried just about, you know, nationally we see more and more kids are being affected, and just by the sheer volume of the amount of kids, you're going to have kids who are seriously ill? That must be something, you know, until now it hasn't seemed like it's a disease that's really, or a virus that's devastated young people. Is that worry you and keeping you up at night?
Well, I think, you know, what we're seeing with the Delta variant is alarming. And it's different. It's more transmissible. We're still learning about it. And so, of course, we're concerned. And I'm sure you've seen the stories about children's hospitals filling up in Florida. And so we're aware that there's the potential that we could have many more cases in children occurring in our community with the Delta variant.
With school just starting, is there, you know, you usually said it's like 2 weeks out. Will we be like 2 weeks out from when we start to see some of the first cases that maybe are transmitted in schools?
I'm not going to try to put a timeline on it. I think with the number of cases that we have in the community, we'll be watching closely if we do have cases occurring in schools, and doing our best to try to get those exclusions happening as soon as possible to try to avoid further transmission occurring.
Any other questions for Kevin Dick or Ann Silver?
This is Michelle. I have one more question, I promise. So looking at the higher number of cases, and then when we compare it to, you know, before in January, December, November, when hardly anyone was vaccinated, is this still, this is going to sound like a general question, but is it how concerning is it that this is happening again for you guys?
I would say it's very concerning. If you look at where we're at, as far as number of cases that are occurring with that 7-day moving average, we're right around where we were, I think, the 20th or so of October, as we were moving into that November surge. And when you look at the increase of cases that we've seen over the last little over a month, as this has taken off, it looks an awful lot like how we were increasing during October going into November. And we're currently at about a third of the level of our peak during that November surge. So our cases are rising rapidly, and that's why it's important that we act now and we respect one another and the governor's mask mandate and do our best to protect each other from further transmission so that we can try to keep those numbers down.
Thank you.
Last call for questions. Okay, thank you all for being here. Thanks to Kevin Dick and Ann Silver for joining us. We're recording this, so we'll put this up on our COVID-19washo.com website here momentarily. And if you have anything further, feel free to reach out to me. And thanks again for everyone for being here. Have a good day.
Thanks for joining us, Ann. Appreciate your leadership.
Thank you. Thank you very much. Bye.